I think we can learn so much in a cross-professional, cross-disciplinary way, because the problems, the language might be a bit different, the way we implement the solutions might be a bit different, but the problems are inherently the same. And so I don't think it needs to be evidence-based medicine or veterinary medicine, evidence-based healthcare or practice or whatever is more inclusive is true. And we need to lean in and listen to each other and become more involved. This conference is great. It's always very welcoming to people in different professions doing different kinds of jobs for the different healthcare settings. So we can learn, so lean in.
And I would say, yeah, absolutely. It's the first time I've actually been along to this conference, and there's been very little that I've gone along to and not seen some relevance and some practical element that we can apply to veterinary. So yeah, I think come along and give it a try.
So yesterday we had a panel and a workshop looking at how we adapt the evidence-based manifesto to the veterinary healthcare setting. So we talked about some of our problems and the solutions that we have. And then we looked at the manifesto as it stands with its 9 points and discussed how that is it fit for purpose for us? If it's not quite, what do we need to change? So we talked about language and how we would need to implement and act on some of the things a little bit differently. And then we talked about the one thing that we need to add is that we have patients and clients. So a lot of the evidence-based manifesto, some of those things would apply to patients, whereas we need to make sure we remain advocates for animals and animal welfare. So we will add a number 10 to the veterinary manifesto.
And what general principles do you think you'll take away from EBM to apply to veterinary medicine?
So I think of the things on the programme today, there's been a lot of talk around conflict of interest, which is something that we've been talking about quite a lot today. So there's quite a difference to a certain extent with the setup, certainly in the UK with the NHS and then the private practice system for vets. What does that conflict look like? And I suppose it's making sure you're transparent but pragmatic as well. I think some of the tensions that you get in the medical world possibly don't happen in the veterinary world, but is that possibly just because we're not looking at it closely enough? So I think that's something that I certainly want to take away and have a bit of a think about.
I think the other thing that I would take away is that it's that relevance of evidence to practice, so we need to also work harder at including the right stakeholders in the planning and delivery, and therefore then the implementation of research. So looking at what stakeholders should be involved in research and working towards improving that involvement so we get something more useful.